I'm Franklin County Presiding Commissioner Tim Brinker. I am hopeful this message finds you all doing as well as possible. Franklin County is continuing to navigate through the various challenges that the COVID-19 virus is causing. Thank you for every single effort you are all making to protect yourself and others from acquiring and spreading this virus. After speaking with Governor Parson, Dr. Randall Williams, the St. Louis Regional Pandemic Task Force, and our Mercy Hospital Washington team, the Franklin County Commission reviewed and implemented a mask order on November 20th, and it will remain in place until December 20th and re-evaluated at that time. We want to keep businesses open so livelihoods will be minimally impacted while we all do what we need to do to get through this. Since the implementation of the mask order, we have seen a definite difference in the numbers. Since implementation, the 14-day case average has dropped significantly from 84 cases per day average on November 20th to 64.07 per day average on December 2nd. Also, the 10-day rolling average of positive cases has gone from 825 in November to 574 to date. The numbers are real and perhaps tell a story. We'll be monitoring the data and making decisions based upon the incredibly vast expanse of information available when necessary. The single greatest challenge to our region is hospitalizations relative to room capacity and staff capacity. I've been closely monitoring and utilizing the resource of our St. Louis Regional Pandemic Task Force that is made up of every major hospital institution in the eastern half of Missouri and quite capably led by Dr. Alex Garza. The current situation within our healthcare providers is, in a word, overwhelming. ERs are struggling, ICUs are struggling, and elective procedure options are going to cease to exist if we all do not take this as serious as possible. While hospitals in our region scaled back on staff during the pandemic impacted spring and summer, the accountants that recommended these staff reductions to save profits weren't counting on these folks moving to other jobs or even other geographic regions in their respective field. Now, as a result of patient surge and inadequate staffing, our valued healthcare institutions must start making the choices that we do not wish anyone to have to make. Doctors and nurses alike are now faced with choosing to treat or not treat patients that have elective procedure needs as well as emergent needs. Here's a list of procedures that are in jeopardy due to the surge of patients in our task force hospitals: heart attack, stroke, cancer surgeries, transplant surgeries, gallbladder surgery, heart surgery, cardiovascular disease, abdominal pains, which delay in surgeries for appendicitis, many issues, upper respiratory issues, including the flu, hysterectomy and other women's health issues or concerns, colonoscopies or other GI-related issues, kidney stones, other urinary tract issues, back surgery, joint and other orthopedic surgeries and treatments, serious infections, like if a patient was becoming septic. Emergency care could also be affected. People who are involved in serious car accidents won't have an ICU bed for treatment if needed. Our ERs may be so full they can't treat common bone breaks or sprains or headaches. I have been assured and reassured from every level that this information is accurate and, like the virus, ever evolving. Please do what you can to keep yourself and others safe. You know what is best for you and your family. It is absolutely time to use your God-given right to take personal responsibility and make the tough first world choices for the greater good. Keep your distance. Cover your aerosol outlets, that is your mouth and nose, when in public, and wash your hands frequently. These are not difficult actions to take in order to get us to a vaccination availability point. Dr. Randall Williams told me the initial allotment of vaccine from Pfizer will be to the 10 undisclosed low-temp storage facilities, 94 below, on the 14th, 15th, or 16th of December. 54,000 doses will be immediately available to healthcare workers, long-term care staff, and long-term care residents. The Moderna vaccine will be just a couple of weeks behind and will be able to be stored in a higher temp environment of -4 degrees Fahrenheit. The full process of vaccination distribution to all Franklin County residents and Missouri residents will be completed mid-year of next year, 2021. Any information regarding vaccinations and distribution points will be immediately disclosed upon notification through every media outlet we know. If you wish to see the various levels of vaccine implementation, you can go to www.health.mo.gov. Franklin County schools are showing incredible resiliency, and we are so proud of each and every one of our institutions, the students, their parents or guardians, and the great scholastic leadership from our incredible community college of East Central, all the way down to our ever valuable daycare centers throughout Franklin County. Your fortitude and commitment to provide is unmatched, and we are grateful. Please know that your efforts are indeed noticed and recognized. Thank you to each and every business that calls Franklin County their home. The sacrifices you have made and continue to make are nothing less than incredible. We are indeed rebounding as Franklin County unemployment levels have gone from 10.9% in May all the way down to 3% currently. Thank you. FYI, if you're looking for work, there are plenty of jobs available thanks to our incredible business partners. Get out there and make yourself stronger and our Franklin County business economy stronger. The Franklin County Health Department is working diligently with our contact tracing and guidance giving to those that do not have a family doctor. We ask that when possible, consult with your healthcare provider for recommendations and personal health care guidance. If that is not an option, please go to the CDC website for recommended actions to help with active virus and prevention. 1st District Commissioner Todd Boland, 2nd District Commissioner Dave Hinson, and I remain committed to our sworn oath to you, to our Constitution, and to America. We also remain ever grateful to each and every American in Franklin County for making this one of the most free, God-fearing, family-loving counties in the United States. Thank you all for your efforts, and may God's blessing continue to all. Thank you.